Hi everybody, it's Dr. Vania Martins, your Brazilian British gynecologist in London. Today I want to talk to you about obesity and cancer in women, okay? What's the link between obesity and developing cancer? Let's talk about endometrial, cancer in the endometrium. Let's put in these terms, that this area inside the uterus, okay? What happens if you are overweight or obese? More fat you have, mainly in the abdominal area, more inflamed you are, okay? This fat might cause one thing we call insulin resistance, okay? Your insulin does not work properly, and then there are loads of sugar around and it becomes fat, okay? It becomes very clear. This fat works 24 hours inflaming your body, and it produces a bad kind of estrogen that might stimulate the line of the uterus, okay? And you might end up with called cancer inside the uterus. It's not cancer in the cervix that's caused by STI or HPV, no. I'm talking about this cancer inside the uterus, endometrial cancer, okay? Cancer in the endometrium. What woman is the higher risk? Obese with polycystic ovarian syndrome, because most of them, not all of them, are overweight or obese. They don't have regular periods. They just have periods every 3, 6, 9, or even once a year, and they think that's normal. Women who are on a drug called tamoxifen, that some people who had breast cancer they take it after having the surgery for breast cancer, is another cause of make it grow. Another person who might be the diabetic woman as well. Usually she's more at risk because if she's diabetic, she already has insulin resistance. And then insulin is a hormone that in excess causes growth. This is the problem, okay? Growth of vessels and growth in the line. So you might end up having cancer inside the uterus, because endometrial cancer or cancer in the endometrium. It's just one type of cancer. The obesity can lead for all the types of cancers, but just one type that women might be involved too. And the other one, of course, that's most common cancer on us, that's breast cancer as well. Of course, breast cancer is multifactorial, but one factor that might helps is the obesity. For the reason I told you before, it might produce bad kind of estrogen, okay, and stimulate the overgrowth of tumor in the breast. So because this is important to keep health, weight, moving, doing good things for your body, okay? Focus on you, okay, and prevent diseases. Bye. It's Dr. Vania Martins, your Brazilian British gynecologist in London.